Hey everyone, and welcome back for a Tuesday past Memorial Day edition of Lunch Break Live with me, Ivana. And today I'm joined by our own Lita Gore. Now, a lot of you have been keeping up with Lita's posts every day, keeping us informed on the coronavirus numbers in Alabama. She has done a great job of keeping us up to date with that and also showing us the number of cases per county and really getting all that information from the Alabama Department of Public Health to us. So today we are going to talk about something that I think both of us have been getting a lot of messages about is once everything is opened in Alabama, are our cases on the rise? If they are, where are they on the rise? We've gotten a lot of reader questions about that. So I thought it'd be a good day to just recover from the holiday, have Lita kind of explain some of this data, the way it's collected and reported, and share that with y'all. So if you have any good questions for Lita, please let us know. I'll be watching them right here, and I will get her to answer. So Lita, let's start out by saying, what are our numbers today, Tuesday, May the 26th?
Okay, as of today at like 9:30, we're at 15,194 cases, which is a big jump from yesterday. We're up over 700 cases from yesterday, but we were up about 3 something yesterday. But there is a little bit of a question there because Memorial Day was 50% of our increase yesterday was from 3 counties, Jefferson, Mobile, and Montgomery. So we may be seeing a lag in some reporting, which is not uncommon. A lot of places were closed yesterday, even the health department, not the health department, but some of the smaller ones. But we are still, the trends are still the same. Our numbers are up, but our testing is up. So the two go hand in hand. And our number of people who are testing positive, our positive rate on testing is lower than it was in March. In March, it was close to 8%. Now it's about 6 something percent. So that adds up. And it's very interesting because the way the numbers are reported is they're reported by county every day. So I'll look at the increase from every day, but I can almost go back and look because the health department announces where they're doing their big testing. I can go back and look and see where the testing is. And within 2 weeks, you see the numbers go up, but that's what you expect. You don't expect the numbers to go, they're never going to go down. They're cumulative. But, we have seen an increase in the last 2 weeks. We have.
And then I've got my calendar here, and I believe the dates of these amendments to the Safer at Home order, and prior to that, the Stay at Home order were May the 11th, 15th, and 22nd.
Right.
Those are when those changes took effect. So what have you seen since those changes and those numbers? And is it too early to say if those openings have affected the case number and this, over 15,000 cases we've got in Alabama?
The May 11th and the 15th we're getting close because you got to think there's, a 2 week or so incubation period. Now, if somebody tests positive during that incubation period, that's actually good because we know that they can quarantine early and not spread it to other people. But in a way, it's especially the last one. I mean, we don't have any idea from that yet. Again, we've seen the numbers go up, especially since about the 15th, but we've seen testing go up with it. So we really don't have a clear indicator and probably won't. Like I said, I'd love to see the test a month out of Memorial Day. I mean, not the results a month out of Memorial Day. I don't know about, I live in Huntsville and I can tell you everyone in Huntsville was out. It just seemed like everything was back to normal. Mm-hmm. So I think that's when we're going to see, but at the same time, even the whole time in March, ever since that first thing, our hospitalization rate, except for very few cases, has been very stable. Our ICU rate's been stable. We're in good shape on ventilators. It gets back to that debate of were we trying to flatten the curve or do away with the curve? As long as we can handle it. And I look at like Marshall County. Marshall County saw this huge upswing. But it turned out it was an isolated upswing in a meat processing plant. Most of the people were asymptomatic. Hospital was okay. Do you worry? I mean, you do worry. You want the people quarantined, but you don't worry as much as, say, Montgomery, where I'm seeing almost 200 cases added in 48 hours. That's a different animal.
Right. I'm looking at some of our comments. Terry talking about how she hasn't seen social distancing. Terry, where are you located? I'd love to know where you were this weekend, or where have you not seen that social distancing happening? Lita, something I think you said that was interesting, I just want to go back to, is that our case number has been rising. Again, that is our testing number has been rising as well. So those two things are correlated. But about the hospitalization rate, you said that even though our cases have gone up, that hospitalization rate really hasn't changed.
It ticks up in certain places. And I know we all saw the report out of Montgomery County where they were dealing with some issues. But no, our hospitalization rate. Now, I will tell you, I do know more about the hospitalization rate where I live. And Madison County and a lot of North Alabama has just been extremely flat. So we've not seen this rush at all. So, if you go back to the original intent of don't overload the hospitals, then we've met our goal. I think we have to decide, are we happy with, I just don't see us ever being to 0 cases. I mean, that's, I guess eventually we will. But as long as that hospitalization rate has stayed the same, the ICU rate, it ticks up in certain areas. We are very much looking at certain counties now, as opposed to, we have counties that have 20 cases. Now they may have 30,000 residents, but then, and we have Madison County, which has 360,000 residents with less than 300 cases. But then you swing opposite ways. Franklin County's had issues, Butler County's got issues right now. And you have to look at the number of cases versus the population. Whereas Jefferson County, while it has been the leader the whole time, except not in cases Mobile was, Jefferson County seemed to be able to absorb those cases better. They have more medical facilities. So that's
right.
what we're into too.
So there's a lot of comments about, I guess, these people specific counties. We will have that information for you. Lita's been doing a wrap up of that every day and giving those cases per county. So she will post her article later on this morning. I'll post it here in the comments so everybody asking about specific counties can see that. But while we're on the topic of counties, I'm getting several questions about Mobile and Baldwin County.
Yeah.
And just the lower Alabama counties. We do know that they had a very high number of cases in the Mobile area and in Baldwin County.
Yeah.
What's going on with Mobile? Are they still on the rise?
Well, a little bit of positive news out of Mobile. Their rate seems to have slowed. And what's I've always interesting, because you got Mobile and you got Baldwin, they're just right there together. Baldwin has stayed behind Mobile, so you think it's maybe more of a city issue. I don't have data on that, so I can't tell you, but it is an odd thing. Mobile seems to have slowed, and you will see this progression. Very early on, we saw Tuscaloosa ramp up, and then it went back down. And we would see these different areas where you would identify a cluster of cases, isolate, and then it would go down. Now, Tuscaloosa's got an issue right now with some other stuff. They're back up. But I would say like Marshall County, we're not seeing the increase anymore. So Mobile seems to be maybe, hopefully, on the downhill of their increase, where we're seeing Montgomery flare up, and Montgomery has flared up, I would say, quicker and at greater degrees than other places.
That's really interesting. And that kind of goes back, like we were talking about the hospitalization rate. Mm-hmm. Let's talk about the death rate. Mm-hmm. Now, coronavirus, some quick stats that you and I talked about earlier was that you said from your data, it shows that women are getting it more or testing mm-hmm. positive more often, but mm-hmm. there is a higher death rate for the men who get coronavirus. Right. And can you tell us anything else about those death rates right now and those death statistics?
What we're seeing from the death rates is 81% of our deaths this is all deaths, are over age 65. And while it's interesting that 58% of our cases are women, 55% of the deaths are men. So it's just a disproportionate. Same thing with racial issues. We see a slightly disproportionate higher amount of Black people who are passing away from the virus as opposed to white people. And the number of African Americans is slightly higher who are testing positive. So it's disproportionately, not a huge amount. Now, huge amounts are your elderly. That is overwhelmingly, it is the elderly and those with underlying conditions, but slightly disproportionate towards men who are dying and African Americans who are dying. What's very interesting is 95% of our fatalities from COVID are people with underlying conditions, and 65% of those have cardiovascular disease. Almost 60% have multiple underlying conditions. So out of our 560 deaths, we've had 25 deaths with no known underlying conditions, and the vast majority of those are older than 65. So again, underlying conditions, elderly, and the underlying conditions are cardiovascular, lung disease, diabetes, the things that we see every year.
What county has the most cases right now?
Let me look and see. That was a pop quiz. That was like a Jeopardy quiz. What?
You can phone a friend if you need to.
I can phone a friend. Yeah, I'm pretty sure it's still Mobile. Let's look real quick.
And while you're looking at that, I'm going to look at some of your comments. There are a lot of comments again about the counties. Lita will have a wrap up for that I should say, in a little bit. I'll put that link here in the comments so you can check it out for today. And some other things talking about reopening, has that affected it? Lita and I were talking about that earlier, and it is something that she says is very hard to tell right now because those amendments in the Safer at Home order where things were opened up came on May 11th, 22nd, and 15th, or 15th and 22nd, I should say. And that is a really tight timeline if you're looking at data to see if that has affected the case numbers. And that's what Lita was saying earlier. And so she said she's going to have to see a little bit more numbers, see a couple more weeks before we can say if these reopenings have spiked the numbers at all.
Yeah. Mobile has the most cases at 2,033, but I think the interesting thing about Mobile is they also have 111 deaths. So you're looking at a particularly, a lot of times when you see these really high death rates in counties, for example, Lee and Chambers, you're talking nursing home issues, veterans home issues. Those are where you see these pockets. And a lot of times when I look in the more rural counties and I start looking at, wow, they've really had an upswing. Talladega County, for example, you can find the veterans home, you can find a nursing home that's dealing with it. Once it gets in one of those, it's a bad situation.
Do you think that's contributed to that death rate in Mobile?
I think Mobile has some of that, but I think Mobile had that early issue of community spread. And I think they really dealt with, I don't know if there were certain clusters, and that's where more data would help. If you could look at, okay, I see this zip code that has this cluster. They had a family reunion and they're all there together, and now we've got 100 people sick. I think that's where that sort of data would help. And Mobile has done some of that, but I think whenever you look at, especially the rural areas that you think, why in the world is, Talladega County having this issue? Oh, wait, there's a veterans home. It got in the veterans home, and you will see a number of deaths fairly quickly.
There's a good question from Robin. Robin asks about Butler County. She said they have less than 20,000 population, and she said they have very high numbers.
They do. Butler County is one of those that I have watched for a while. And let me tell you, Butler County over the last 24 hours added 24 cases. That's a lot. They have 180, they have 400 cases, almost 400 cases, 368. So they're higher than Madison County, which is population 360. Butler County, but at the same time, we saw the ADPH go through with testing all in that area, but Butler County's got an issue. So I don't know. I will look at that and see if we do have some sort of nursing home. A lot of nursing homes at the beginning weren't reporting a lot. They were reporting it to the health department, but we weren't getting data that said XYZ nursing home has an outbreak. Now, some were coming out and saying, yes, we've got this issue. So I'll look on that and see, and I'll add that comment if I can find if there's a specific reason, or if we just have a community spread issue. And where you run into problems in the more rural counties is there's not the available health care. So then you're having to go somewhere else. And of course, your family can't go with you. So you're by yourself, which would be horrible. And, if you're in Butler County, there may not be the healthcare facilities available. That's where we run into issues. If someone's sick and they're staying at home and they're getting better, we can deal with that. But when you start flooding hospitals is where you have a problem. But I'll look at Butler County. I've noticed it too. It's had an issue.
Another question from Brenda. She was talking about Walker County, and so that Walker County is on the rise.
Walker County was one of those ones that very early on jumped up. And I was watching Walker County. I have family in that area, and I was watching Walker County, and then it just nice and smooth, flattened out. Walker County jumped 40 overnight. Now, I think a lot of that may be a testing error because they've been in the 8 to 9 range, but that's still a lot. And I think some of that is your Birmingham metro area. You're getting more people back and forth. People are going to work. that maybe weren't before and bringing things back with them. No offense, Birmingham. But I think you run into that sometimes. But yes, Walker County has been an issue in the last, I'd say, 2 to 3 days. So you're looking at 2 weeks ago. So you got to think, is that when people were going back to work?
Mm-hmm. Right. And I'm reading some of our comments here, and people again are talking a lot about different spreads in different counties, and like what you were saying, trying to pinpoint maybe a cause. I do have one question from Maddie who wanted to know more about Talladega County.
Yeah, let me look at Talladega County. Now, I don't know. I think they had some issues. Okay, overnight we were at 1 increase, so we love 1. 1s are good.
Right.
I think Talladega again was one of those that jumped up and then slow down. And that's what we see where you get concerned, because I've kept a graph of this from the start. And where you get concerned is when you don't ever see the slowdown. If someone adds 8 cases and then they add 2 and then they add 1, you're like, okay, But when they're at 8 and then they add 24 and then they add 36 and then they add 74, that's where you get concerned. And I've not seen that in Talladega. So hopefully we're good and they'll be racing soon or something,
I know I've already got people saying in our comments talking about staying home for football, so you can stay home for races as well. I guess Talladega's looking for that. Mm-hmm. So interesting comment from Annie. She's asking, do you see some of these numbers going down? This is me putting my spin on your words, Annie. Yeah. But those numbers going down in some of these cases, is that a indicator of that there's a second peak coming?
I don't know. And I don't know if anybody knows that answer. I certainly hope not, because I don't know about y'all, but I would like for my child to go to school and be out of my house. I don't know if we see a second peak coming. I think we will be better equipped, and I think all the health officials have said. I think this is total Lita opinion here. I think what you will see, and what we may see soon in some of these areas in Alabama, is a more targeted approach to a shutdown. Instead of shutting down, Limestone County with 55 cases or whatever, they've got more than that, but whatever they have, because Mobile has a problem, we would shut down Mobile. I think that's what you're going to see more. I'm kind of surprised that didn't happen last week with Ivy. I expected her to leave Montgomery shut down, similar to what we've seen in, or Montgomery officials to do that. Similar to what we've seen more in Birmingham and Jefferson County, where they've said, no, we're not quite there yet. I think you will see a more targeted approach. Now, one little interesting, and I get a lot of questions about this just because, and I thought that's where they were headed. When we talk about county numbers going down, they actually do go down. It's a cumulative number. But people will say, we were at 500, not 500, we were at 48 yesterday, and now we're at 46. Well, the reason that happens is, if I'm in Jefferson County, I live in Jefferson County, but I go to Walker County to be tested. I may initially be listed as a Walker County case, but once they realize I live in Jefferson County, then I'm taken out of Walker County and reassigned to Jefferson County. So your coronavirus cases are not where you're tested, it's where you live, which makes sense. But those swapping back and forth have happened since day one. And so
that's interesting to note. Just if you go and look at some of Lita's, again, she's been doing this every day. If you look at some of her numbers one day and then look at it the next day and you see maybe a minus instead of a plus, that's a good point to note that could be why.
Right. There's a change in county residents. And you got to think, look how many people live in Walker or St. Clair or Shelby and work in Jefferson, or opposite. That's going to happen all the time.
Mm-hmm. I had another question about that reporting I wanted to ask you, but first I'm going to answer this question because I know you're ready to talk about it, Lita. It's from Linda, and she asks, why can we not see what zip codes the virus is in?
Trust me, Linda, I understand. Mobile has done that. They've done zip codes. The health department has not. They have cited privacy regulations, and that in certain zip codes, if you have fewer than X number of people, it could be identifiable and blah, 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 blah. I understand to a degree, but it drives me nuts. Trust me, we are reporting all the data we can get our hands on, but I don't like to take data from places other than the official source because you just don't get the right stuff. The health department has slowly but surely increased the amount of data they're releasing. I don't know if staffing wise we'll ever get to zip codes. I would love to, because I look at Florida's data and it's much better than ours. I think if you're going to do targeted shutdowns and restrictions and quarantine and blah, 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 you're going to have that information. But we don't, the health department does not do zip code breakdowns. And trust me, I would love it personally. Just for me, I think it would be very interesting, but they don't do it.
That's something that we've gotten a lot of questions about. So I'm glad we got to go ahead and address it. Y'all have really good questions today. First, let me ask you something about reporting. We talk about that minus number because of maybe cases getting shifted from county to county. Let's also talk about this data dump that a lot of us are talking about, a lot of us are seeing. And if you don't know what I'm referring to, I mean, if there's, say, a 700 case dump, could that be a rise rather? Could that be because, and this is the question, is that large rise in actual cases going up in a short period of time? Or is that because of the data just coming in and being added to the ADPH's numbers in a batch instead of daily?
Yeah.
What do you know about that data dumping and if that's happening, when it's happening, and why?
Yeah, I have that question in as far as Memorial Day right now, and I've not gotten the answer back. We have seen, just like every other site, the website has glitches. The ADPH website has glitches, and we've seen these weird, there was one that showed this huge amount of increase in healthcare workers that had COVID. It was just an error. We've seen those kinds of things. My concern about the increase of 700 cases is if we showed 50 cases increase yesterday, I would be like, okay, but we saw 300 something yesterday. So I think there were some delays because I'm seeing counties with upticks that don't normally have them. And one thing that I know was happening early on is a lot of your private labs were reporting positive results, but they weren't reporting negative results. So we didn't have a true testing number. I think that testing number is more accurate now. But at the time, a lot of that information was just hand input and you had to submit it. And there are going to be human errors. So we don't have an answer if there was this Memorial Day data dump. I suspect it was, let's say it was 100 extra cases. That's still, we're 600 cases up. So again, Montgomery was up 124. That's a lot. That's a lot.
Right. I'm going to quickly answer. Jennifer and Julie both ask about, has there been a discussion to go back to enforcing shutdown measures that have been loosened? We don't really have any information on that, Jennifer and Julie. That is something I know in the governor's last press conference, she made some sort of comment about how if things get bad, we might have to do something like that. The governor did not give any other guidelines for going back for harder or harsher rather restrictions. So we don't know the answer to that. We will keep you updated if the governor comes out and says anything. Let me ask you a couple of quick questions, Lita, because I know we don't, I know you got things to do and we all do, but this is an interesting question that I've seen from several people, and including Laura just brought it back to my attention. She says, if there will be an increase of cases from all the extreme crowds like we saw at the beaches this weekend, when will it show up?
Well, that's a good question. Incubation 2 to 3 weeks. And then you've got to be, and if you're asymptomatic, who knows if you ever go and get tested. That's really the big concern. If you're showing symptoms, you go and get tested. I know where I live, I knew someone who got tested very, very recently and said it was super easy, no big deal, walked down, got tested very quickly. I think a month from now, I want to see the numbers.
About a month. Okay.
Yeah.
Another question. This, I think, kind of goes to Jolene. First of all, I love your name, Jolene. Second of all, she is asking, I think in a roundabout way, what is the rate of deaths versus our COVID cases? What's the percentage?
I don't know that. I know at one point it is, well, hold on though, because I can tell you that high school math class has really come in handy these last couple of days.
Somewhere Miss Elkins is very disappointed in me. Math was never my strong point, and somewhere Miss Elkins was like, I told you.
It wasn't my strong point. I will tell you this, it is low, thankfully. We're looking at like 3%.
Okay.
That's my back of the envelope math right there, so I may be off a little bit.
But it's under 5.
Yeah, it's under 5.
Sherry asked again about zip codes. No, Sherry, unfortunately, we can't see the zip codes except for Mobile. Is that correct?
Yes, Mobile has the zip code information.
So Sherry, she says
I don't know when it's updated, so there could be a delay there. but they have been releasing zip code information.
Got it. Well, Sherry, you live in Mobile, so lucky for you, you can see the zip codes in that area, but we can't see them for the rest of the state. Sorry about that. We also wish we could see them. One other one that I wanted to get to as well, this is interesting, actually, from Kimberly. She said, are the positive numbers tests or cases? For instance, if one person tests positive multiple times, is that reported as a new case?
It would be reported as a new case one time. It would not be reported. Okay. I mean, I guess if they go back, 6 months later and test it. Now, one thing I do want to clear up real quick, because I hear this rumor a lot. Just because one person in a household is tested does not mean everybody in that household is listed as positive. That rumor spread, and ADPH came out very quickly and said, no, that is not the case. They don't say how many people live in your household, so now 5 are positive. That's a rumor. It is not true.
Got it. Thanks for clearing that up, Lita. Quick question, Dana, neither of us are medical professionals, but I believe Lita and I both would say, she says that she has a coworker testing positive and she has a small child with breathing problems. Dana, I think Lita and I both would say that the advice from ADPH is that you should get tested. Yeah,
absolutely. Well, and I hope we get to the point where, like I said, that friend of mine whose son was showing symptoms, and it was scary. I mean, the symptoms were scary. They were both able to get tested in Huntsville without an issue, got the results back within 48 hours. Negative, so we're good. We're glad.
Awesome. Good luck, Dana. We hope that yours is negative as well. One of the last question I'm going to give you, Lita, is people are still asking what's going on in Mobile. I think, we have people kind of jump on and jump off. So I know we talked a little bit about Mobile. Can you go over the situation happening in Mobile and their case numbers?
Yeah, Mobile. There was a great article on AL.com this weekend, by the way, that I just thoroughly enjoyed looking at Mobile's response and Huntsville's response. Great article. Mobile peaked and Mobile started growing a lot. I have seen Mobile slow down. That doesn't mean quit doing what you're doing, because you need to stay inside. If I was in Mobile or Montgomery, I would treat myself. I think I would handle things a little bit differently. As far as me personally staying inside. Mobile to me seems to be on the start of their decline. Let's hope so. Because I've seen some stats there about an elderly population. You've just got some risk factors that you might not have in other parts of the state. And I think any county where you've got an older population, maybe more underlying conditions, that needs to be treated differently. So good news, Mobile may be slowing down some, but please be careful.
I lied to you. We do have one last question. Her name is Angela, and she's asked us a couple of times, so I'm going to get it, Angela. She wants to know about children's cases in the state. What are the numbers there?
Let me look at that. We have been very fortunate, and as a mom, I'm very, anxious to see that myself. Let's see.
While you're looking up that, I'll go ahead and answer you, Maureen. She wants to know about nursing home and the VA institutions' impact on hospitalizations.
Yeah.
You're right, Maureen. We have talked about that. The nursing homes, VA homes, things like that, veterans homes have been, you can see sometimes in the counties that have a larger amount of cases or a larger amount of hospitalizations, often it is stemming from one of those facilities in their county. So you are right about that.
Yeah, we're showing 11% of our cases are 5 to 24, ages 5 to 24, and only 1% are 0 to 4. Thankfully, we have no deaths under people under age 24. Thankfully, we don't have any pediatric deaths or even anybody under age 24. So good news.
Good news. That's wonderful news for our day. Let's end on that good news, Lita. Y'all have had great questions. If you have any more we didn't get to, please send them to me. My name's Ivana or Lita Gore. And you can find both of our emails and everything on the website. And Lita will have a wrap up kind of about what we talked about and then about the county by county case numbers here in just a little bit. I will put that link on this thread so all of you can see it. And you can hopefully that will answer some of your questions as well. So Lita, thank you so much for spending time. We might have to rope you back in here to answer some of these questions later.
And if they have specific questions about a county, I'm happy to answer them. Just shoot me an email.
Got it. And her email is lgore@al.com. Mine is iherandq@al.com. I know that's a mouthful. I'll leave it in the comments. Thanks so much. I hope everybody had a great weekend, and we will see you tomorrow.
Thanks so much.